Hi, my name is Dr. Lonnie Herman. Welcome to this video, and thank you for letting us come into your home to share this information. Um, you probably are watching this video on the internet, and you have most likely tuned into one or more of my websites, whether it's about fibromyalgia or chronic fatigue, for cancer, alternative cancer treatments, thyroid disease, and so on. I'm going to share the story with my patient's permission, with people from with different conditions. My patient here right next to me, her name is Pasqua. She lives a few hours north of my office here. She came down to get evaluated because she was diagnosed with cancer in her right breast and in both lungs it was, and no other part of the body.
Well, there's an area in the pharynx that's
Okay.
questionable.
So
It was highlighted on the PET scan.
okay, so in the pharynx, in the neck, and in the right breast, and in both lungs, she was diagnosed with cancer in May of 2013, and it was a respiratory doctor who found it. What type of
Yes,
doctor
a
found it?
pulmonary specialist.
And
yes.
were you just going because you had breathing problems, or?
I did. I was diagnosed with asthma some 10 years ago, but I was referred to him because the tumors were found to be in the lung.
Okay,
At that time, we did not know there was an additional in the breast.
okay. And how'd you find out about the breast?
The pulmonary specialist pointed it out to me.
Got you, okay. And right after there, they tried to refer you to an oncologist, you told me, but
Yes.
that was not something you wanted.
That was not going to be an option. He demonstrated using a ballpoint pen what he would do, and he wanted to go in with a scope and would have a little brush at the end of his instrument to brush and stroke the area in my neck. And right away, I just envisioned cancer cells spreading.
Mhm.
And he then said that he would go to the lung area and give it maybe 4 to 6 punctures with a needle to get sampling of cells. And at that point, I told him I did not like that idea.
Mhm.
It was scary for me, and that I was looking for more natural methods.
And you didn't like that because you thought there could be spreading of the cancer, and okay.
Right.
And
I felt it was too invasive,
Mhm.
more infection spreading possibly.
And and that can happen, that's true, it's possible. We're not telling people not to do that if that's their decision, and nobody's trying to step in front of any other decision that they have to make. If they want to go through chemo, radiation, or biopsies, that's up to them. And you went first to some other kind of chelation alternative therapy center,
Yes, I did.
and they offered you
A high IV vitamin C.
high dose IV vitamin C. And was that every day of the week? Was that
I
just a
did
few-
that twice a week for a period of about 4 or 5 weeks.
And did you notice any positive changes?
Not really. And I kept telling them I don't know why I keep coming back for an additional, but it's really not making much difference.
Okay, not difference
Yeah.
with the way you
With
were
the way I was
breathing?
feeling overall.
Feeling overall, energy,
I
sleeping.
had total lack of energy.
Okay,
Prior to that, I did go for major autohemotherapy, and I intended to go for about 6 sessions, but after the third, there was a mishap where the blood was withdrawn too fast, and I passed out, and my husband just thought I should not go back, although I knew it was an error that took place, and I really wanted to complete that, but did not.
okay.
And that's when I moved on to the high-dose vitamin C.
That's vitamin C.
And that's when I found you.
Okay.
And since then, my energy level has been through the roof compared to the way I was feeling.
Awesome.
I really feel so much better in many ways that I didn't expect. I used to take allergy pills 2 to 3 times a week. I have not taken one since I was last here over 3 weeks ago.
Awesome.
I,
And that's what she said. She's been with us. She came down. We did a whole week workup on her, evaluated everything that needed to be done, and she went back home and did her homework, followed the treatment program, and is back now for a reevaluation 3 weeks later. So for 3 weeks, no allergy pills.
none whatsoever.
What else?
My arthritis had progressed. It was very bad to the point where I would have swelling in my joints.
Mm-hmm.
Redness, they felt hot, and I thought, could I have an infection? Since I've been taking the supplements, there's no swelling, no heat, no pain.
Awesome.
I'm able
Wonderful.
to use my fingers and hands the way I was once able to.
Wonderful.
So
What else?
that's a
did you
big
notice?
difference. Then I noticed that some 10, 11 years ago, I developed some darkening. It looked like the outline of a tattoo. I've never had tattoos, in the shape of a butterfly. And it kept getting darker, I think with some exposure to sun even darker, and I just noticed it totally faded. Along with
Wonderful.
liver spots all over my left hand, some up my arm, they're completely gone. I still have some on my right hand. They've lightened up tremendously.
Mhm. And we're still
Just
going
little.
through more of the liver detoxification protocol.
Right.
So we may see all those disappear completely.
I'm thinking if this is what's happening on the outside, I hope that there's a lot more good stuff happening on the inside.
It is, and you could breathe easier, and you have energy, and you actually don't need to sleep more. You're waking up with a lot of
No.
energy after 4 or 5 hours of sleep
Exactly.
because we know what to do. Was there any other changes that you experienced?
I couldn't remember them, so I made some notes just to jot them down. Being that I'm not having the symptoms, I'm forgetting.
Hmm.
For the past, I'd say 2 or 3 years, for whatever reason, I kept getting bitten by mosquitoes and had a severe overreaction with itching. And again, I had swelling, bruise-like marks, to the point where it felt as though someone was pressing in on a bruise mark really hard. I got bitten more recently and never had that reaction. Not to mention the itching. At night I would really go at it and break the skin. I tried cortisone and various other anti-itch and didn't really help much. But with all the supplements that I'm taking, I think has made that big major difference.
Wonderful. Awesome. Very good. So we've done some of the homework that needs to be done to fix her, and we haven't had a follow-up yet. Are you going to be going back, a follow-up with the pulmonologist?
Oh no. No.
You don't want to do any of that
No,
follow-up work?
They did absolutely nothing to help.
A follow-up to just see and measure where they
They
found
do
the
want me-
overgrowths in the
yeah.
lungs and the breast?
They do want me to go ahead and have a scan. It was suggested once a month, and I opted to do it every 3 months. I'm due to have another one maybe by the end of the year.
Okay.
And
Which
since
is
my
just now,
original,
this is middle November, end of November, so that's in just a month from now.
right,
Okay.
the previous one showed that they did shrink a little bit.
Mhm. So now we're going to see if we got more shrinkage.
Yeah.
And there's a lot more that's going to be done. Actually, just now we're really getting deep into a major infective killing program without antibiotics. And we're probably going to touch back in with you when you might come back before the end of the year or the beginning of the next year.
The end of the year.
The end of the
probably.
year, she's going to be back again for a checkup. And hopefully by then we have some more news about, the scans. And I don't expect them to be all gone, quite honestly, because we still have more work. We've got the infections that we've got to get rid of. And it is pretty known in the literature that infections are in cancer cells. And one school of thought says that cancer, from the American Cancer Society, that cancer is not caused by infection. If you go on Wikipedia, there are some parasites that I found in my kinds of exams with people. And even on Wikipedia, it says that this parasite is a carcinogenic, which means the infection can cause the cancer. So it makes no sense that the Cancer Society can say infections are not the cause of cancer, even though they can be one of the causes, but they won't even agree that it is the cause. They say that infections come up after the cancer has already formed. There's a whole nother school of thought that's been going on since the mid to late 1800s that says infections are always there with cancer and they can cause the cancer to develop. That's besides cigarette smoke and other toxins and so on, which I talk about in my cancer videos. But I want to appreciate you, Pasqua, and tell you I appreciate you for sharing this information with people. And hopefully the next time I see you, if there is even better news, that we can share some more with people and they can just follow this journey with you a little bit. So your overall energy and function, you feel so much better
Unbelievably
within 3
better.
weeks.
Just within a period of 3 weeks' time.
And it feels like our system of going through and analyzing your body, there's a rhyme and a reason to, when I go through and check things on your body, you can tell that. And we would definitely recommend other people to do this, yeah?
Oh, definitely.
Definitely.
Without
Thank
a
you.
doubt.
Thank you very much.
Absolutely.
Okay, and our number here, we've got 2 phone numbers, 954-370-3100. And if you live outside of Florida or outside of the United States, we've got an 800 number, 1-855-270-HOPE. That's 1-855-270-HOPE. And we do hope that we can help you as well. Thank you very much.